The relationship between smell loss and specific types of dementia has become clearer through recent research findings. According to the Alzheimer's Association, smell loss can precede dementia by up to 15 years. Olfactory dysfunction appears particularly connected to Alzheimer's disease because the olfactory system provides direct anatomical connections to brain regions affected early in the disease process. The olfactory bulb connects directly to the entorhinal cortex and hippocampus, areas crucial for memory formation that show damage in early Alzheimer's development. This direct pathway makes smell testing increasingly valuable for early detection purposes. Recent studies reveal that olfactory impairment correlates with faster cognitive decline and measurable volume loss in brain regions that support both smell processing and higher cognitive functions, including language and memory. When smell function deteriorates, it often signals that these multifunctional brain regions have begun experiencing the neurodegeneration that characterizes dementia progression. Hearing sensitivity changes and noise processing difficulties serve as early warning signs because auditory processing requires complex brain coordination. Age-related hearing loss affects both peripheral hearing organs and central auditory processing systems in the brain. However, dementia-related hearing changes involve additional difficulties with sound interpretation and filtering background noise that extend beyond typical hearing loss patterns. People in early stages of cognitive decline often struggle more with noisy environments than their hearing loss alone would predict. They may avoid restaurants or social gatherings not because they cannot hear well enough, but because their brain has difficulty filtering competing sounds and focusing on specific conversations. This processing challenge indicates that central auditory systems have begun deteriorating alongside other cognitive functions. The 2025 Alzheimer's Disease Facts and Figures report confirms that problems with smell, hearing, vision, and other sensory abilities increase risk of cognitive decline and dementia development. These correlations have led to increased recognition that sensory changes represent legitimate early warning signs rather than unrelated aging effects. Healthcare providers now routinely assess multiple sensory functions when evaluating cognitive health concerns. Individuals with combined smell and hearing difficulties face 4 times higher dementia risk compared to those with normal sensory function. These findings have transformed early detection approaches, with sensory testing becoming standard components of cognitive health evaluations. Sensory disruptions occur as neural pathways begin deteriorating because the same brain regions process both sensory information and cognitive functions. The temporal lobe processes auditory information while supporting memory formation. The occipital and parietal lobes interpret visual signals while managing spatial awareness and attention. When neurodegeneration affects these multifunctional areas, both sensory processing and cognitive abilities decline simultaneously. Families often dismiss specific sensory changes that actually indicate cognitive concerns. A person might complain that food tastes different or lacks flavor, attributing this to medication effects or cooking changes rather than recognizing olfactory dysfunction. They may claim that people mumble more frequently or speak less clearly, not realizing that their auditory processing abilities have declined. These complaints represent genuine sensory processing changes that warrant medical evaluation. Visual changes beyond simple acuity problems also signal cognitive concerns. Someone might struggle with reading despite having appropriate glasses, experiencing difficulty tracking lines of text or maintaining focus on printed materials. They may have trouble recognizing familiar faces in photographs or distinguishing between similar-looking objects. These problems indicate that visual processing centers in the brain have begun experiencing dysfunction rather than simple, eye-related vision changes. Recent research demonstrates how sensory training interventions can help preserve cognitive function when implemented early. Hearing aid use may delay or prevent cognitive decline, according to 2025 studies. Individuals using hearing aids experience slower rates of cognitive decline compared to those who do not address their hearing loss. This protective effect occurs because maintaining auditory input helps preserve neural pathways that support both hearing and cognitive processing. Smell training programs involving regular exposure to various scents have shown promise for maintaining olfactory function and potentially supporting cognitive health. These interventions work by stimulating neural pathways between smell processing centers and memory regions, potentially slowing the deterioration that characterizes early dementia development. Addressing multiple sensory changes simultaneously provides the greatest cognitive protection benefits. Combined interventions targeting hearing, vision, and smell function help maintain the neural networks that support both sensory processing and cognitive abilities. Early recognition and treatment of sensory changes represents an accessible approach to cognitive health preservation that families can pursue before obvious memory problems develop. The connection between sensory function and brain health extends beyond what most people expect, revealing that the body provides multiple early warning systems for cognitive decline. These sensory changes represent just one category of surprising physical indicators that can predict dementia risk years before traditional symptoms appear.